Marta, because you've just spoken, could you let our audiences know what your next steps are for Portugal? You've given us lots of recommendations there.
Yes, so in regards to digital marketing, next we want to apply a capture on screen methodology as similar to what Joana presented, really to capture all the other types of digital marketing that we were not able to capture in the investigate exposure step. And we would also like to apply the knowledge sharing step in the click monitoring framework. So we want to have some focus groups with children and adolescents to really understand their knowledge and awareness about the food marketing that's targeted at them.
And Marta, you've been involved in several initiatives on a European-wide basis, and we mentioned Best Remap. How does that kind of collaboration across jurisdictions help to enhance the process around policy development?
Yes, we have been involved in Best Remap and now in the current joint action Prevent NCD. And it's in fact very important to have this cross-country collaboration because we all face these same challenges when it comes to both monitoring food marketing, but also to implement policies to protect children. So in these platforms, we can exchange to share experiences, also to share tools, monitoring tools, for example, and also another important group is the WHO network for reducing marketing pressure to children that also allows the countries to share their experience and knowledge in this area, which is a very difficult and complex area, as it was also in the Mentimeter in the beginning.
Great. Do we have any questions from the floor here? Yes.
As do I need to say it again? From there, like.
I don't think that's on, Hannah.
Good. Don, don't have a set.
Hi, can you hear me now?
Yeah.
Do you want me to say my name?
Please.
Hi, I'm Hannah McCord. I'm from the Public Health Agency. My question is for Rebecca. I wish I'd written a better note of what my question was for you because I wanted to ask it straight after. But thanks very much for all your research. Unfortunately, none of it is surprising, which obviously is disappointing in this room. You have explained some policy actions that are taking place, which is great. But what actions can we take in the room? You know, we can all take home messages now, today. So what can we do kind of on a personal level while the kind of policy strategic piece is playing out in that kind of slower pace?
Yeah, so I think it's quite easy to feel a bit helpless when you see all of the marketing on show and the kind of lack of current regulation. I think one of the most important things is sort of spreading this kind of understanding and awareness of the marketing with our sort of networks to kind of raise awareness. And I think a lot of the sort of personal responsibility stuff with parents and the children themselves, I tend to sort of side away from, because I think a lot of evidence we see in terms of these sort of literacy interventions and so on are not particularly positive. So I think really we just need to sort of put a little bit more pressure on policymakers and sort of, I think we do need a little more evidence using frameworks like CLIC to sort of bring home the sort of actual exposure that young people are experiencing. But yeah, I think it's just about taking this message, creating more awareness and putting this extra sort of pressure on policymakers, is what's important.
Thanks, Rebecca. There was another question somewhere there and get it.
I think it's got his
I think that was kind of like my question as well. I'm Julianne Dickinson. I'm a freelance weight management dietitian. And basically, I would find myself apologising to my clients a lot of the time. I apologise that they can't go into the petrol station and buy their petrol without being bombarded by unhealthy advertising. The kids can't go to school without unhealthy advertising on the bus stops. Social media. Now, I was totally unaware of the gaming, to the extent of the gaming, and I just wonder, as healthcare professionals and as parents, what can we do? Is it simply calling this out?
Yeah, so I think it's calling it out. I guess I did touch on a little bit of the advertising literacy side of things. So there's kind of some theory and frameworks to suggest that if you do recognise the advertising, you're better able to sort of resist it. So I guess that can help sort of, as an individual, you can feel like you can, I suppose, advise that. But I think because it's difficult because we don't have a lot of evidence to support that actually having real impacts. There's a lot of sort of, it's hard on an individual level to take that on. I think, for me personally, I think it is about putting that pressure on the policymakers. And I guess with young people in particular, just helping them become aware of, I guess, the underlying motives of some of this marketing. And these influencers are not like always their friends. They don't always have their best interests at heart. They're there to do a job and they're there to promote these products. So I think, some level of understanding there can be helpful. But I think we do need sort of systemic change and policy change to really address the issue.
Thanks, Rebecca. You'll have a word, I think, Joana. Can you hear me?
Yeah.
Yeah.
Oh, yeah. Thank you very much for your presentations. They were very helpful. My question as a policy maker is there is a significant amount of pressure to try and change how we do things. We're in the second iteration, or we're in the process of developing our second iteration of the Obesity Policy and Action Plan. And that's one of the areas that we haven't maybe progressed as much as we would have liked to, is in the area of regulation. But given that you all gave us some very nice examples of using the CLIck study, I'm just wondering, because I'm listening to the same evidence as you guys, but then when you try and project that to people who have to make decisions, when they're thinking of the entire ecosystem within a country, they're always challenging us for more evidence. And it's been clear today that the evidence is a challenge. So my question is, well, how do we scale up using tools like CLIck so that we can get more evidence for our politicians who make the decisions?
Noan, you were involved. Maybe that's one for you.
So today I talk about meal delivery apps, but I was involved in the CLIck framework as well as this studies on monitoring digital marketing. Like, as I'm coming from the technical background, like I know like the main challenge, like even like all the studies today we discuss, like the sample size is really small because it's really hard to manually monitor those things and identify the advertisement. And especially like if you talk about influence marketing or the indirect advertisement or the brand marketing, like maybe the colors or the slogan, it's really hard to manually do. Like that's why like WHO, like our team, we're working on a AI-based approach. We have something called KidEd. Like we were piloting it for like a couple of years. So last few years we had a couple of issues, like mainly not technical issues, ethical and clearance side and the legal side. Like hopefully like soon we can resolve those issues. And like that's, I feel that is the only way you can do like the national level study, large scale study to show the evidence. This is what exactly happening. So.
Thanks, Leona. And because you've raised AI, Noan, there is a question from our online audience on the use of AI in the study, the CLIck study that Joanna presented this morning. I know the answer because I've seen Magda Muck present this, so if you don't mind, I'll answer this, Joanna. Originally, the methodology intended to use AI to analyse the data. You need deep learning models that use image recognition as part of the development of that methodology. And that had been developed in Australia. And so the first job for the researchers was to test that methodology in an all-island basis. And what they found was that the model from Australia didn't recognise, and hopefully I'll get this number right, about 70% of the images within the island of Ireland context. So it wasn't possible to do AI at the time. Now, things have developed so fast that I'm not sure if that's still the case, but certainly in 2022, when this work began, they had to switch to manual investigation, and that's why it was analysed manually. So a couple of people have asked that question, and hopefully I've answered the question for you. Joanna, there's another question for you here, another couple, the dates when the data was collected, which I may have just answered, and are some of the social media platforms more prolific than others?
So in general terms, the research project ran from 2022 to the end of 2024. I don't know if the person asking the question is asking in relation to the screen data, to the capturing, and if that's the case, it was end of 2024. In relation to your other question around social media platforms being more prolific than others, the report has data in relation to paid advertisement, and it's really Alphabet and Meta. So Instagram, Facebook, and Alphabet is Google and YouTube. And they had more than 70% of the paid advertising space in Ireland. TikTok was growing at the time the report was being written, and there was a forecast for an increase of over 40%, and that would mean that TikTok would own a space of about 13% in terms of paid advertisement, and that was largely due to younger audiences within the platform.
I think there was another question at the back here, am I right? Great.
Is this working? Yes, it's working. Hi, my name is Emma Calvert. I'm an NGO consultant. I wanted to ask about enforcement, because we talk a lot about legislation, but if we don't enforce, then it's kind of a paper tiger. And we have these new rules in the UK coming in. I was just wondering, from the panel, do we feel that enforcement is there in terms of being able to enforce these new rules? And what sort of problems would these new innovative advertising platforms such as gaming pose for enforcement? And are there best practices across Europe on that regard? Thank you.
I don't know if you want to give a Portuguese experience, and then maybe Rebecca, you might come in as well.
Yes, in our law, the Directorate of the Consumer is responsible for the enforcement of the law. So there are penalties for those who do not comply. And as I mentioned, we had 7 of the proceedings that resulted in penalties. So yes, we have that, but also it's difficult because in our law, content that it's aimed at children, it's not clearly defined. So there's some ambiguity in what I consider as advertisement targeting children. And sometimes when we show these results and say that this advertisement is not complying with the law because the content is directed at children, the food industry or the advertisements can argue that the advertisement is in fact targeted at families. And so there is no penalty there.
Yeah, so I think to add to that, thinking about live streaming platforms specifically, I think enforcement's going to be a real challenge. I think one thing is like the sheer volume of the content. So a lot of these live streams are many hours in length, and often what will happen is they'll be live streamed and then the video won't always be saved, so you couldn't sort of look back over it, review it and look for breaches. So I think that's a real concern, and then that's sort of coupled with a lot of the strategies I mentioned, which make it difficult to sort of note whether it is like an authentic placement or whether it is like a paid placement or some kind of partnership going on between the streamer and the brand. That's really difficult. So I think we need a lot more transparency on those partnerships, and I think we do need I guess, bigger consequences for those companies that don't adhere to them. But yeah, I do think it's a real challenge for those environments.
Rebecca, I'll just stay with you for one moment. You described, even in the small clip that you showed, a number of different methods of advertising. And then how do you measure? And Joanna talked about, there was 2 different products. They weren't going to be double counted. That was just counted as one exposure. But you're talking about multiple exposures within one even screenshot. So that's going to be incredibly challenging, right?
Yeah, so currently there's a few different approaches we've explored. So just going into a little bit more detail on the content analysis approach we used WHO methodologies. So this was sort of identifying the top influencers that would be most popular among young people. So you're looking at things like followers, whether they've won things like Kids' Choice Awards, and then looking at a sample of their videos and sort of using a researcher-led approach to code like instances of food cues, the healthiness, etc. So it's quite a manual approach. And then alongside this, there's certain platforms that will pull data from places like Twitch and YouTube Gaming, and you can purchase this data to see like the number of brand appearances, product mentions in the chat, that kind of thing. But my view is that it would be best to sort of triangulate this using some of the like click approaches. So asking young people who use these platforms to sort of document when they see any advertising through screenshots, that kind of thing, or some kind of screen recording software. But of course that in itself is also imperfect because they might not recognise things as advertising, and therefore you wouldn't capture that. So I think triangulating those 3 approaches would give us the best picture of what they're seeing on these platforms.
Sinead?
Hi, I'm Sinead O'Mahony from the FSAI. There's been quite a bit of conversation internationally and in Ireland lately about social media bans. And I suppose that could give the impression that, well, if children under 16 aren't allowed on these platforms, this advertising is no longer an issue. But in reality, what we're hearing today is the digital marketing is so much broader than a few social media platforms. And I suppose it's just a question to the panel of how to communicate that complexity, so it's the need to restrict the advertising isn't lost if the approach of banning access to social media is pursued.
Joanna, do you want to?
Yeah, the first issue that we face is that we know that children lie in relation to their ages when they register for social media platforms. It's probably the only time where they can really say that they are older, so they are going to do it. So even in terms of making that ban effective, you face a challenge straight away because you're not going to get every child to disclose their real age. So that is an issue in itself. A lot of the targeting then, or a lot of the advertising is done through interests, not age. So again, the age equation is not going to play a huge role in restricting what they see. What are we banning them from? What are you classifying as a social media platform? And then again, the gaming elements, for example, the meal delivery apps. I've heard recently of colleagues in Northern Ireland that know that some children are getting food delivered to the schools. So they have those apps on their phones. Are those apps going to be banned too? So I think there are a lot of questions in relation to, I'm not against the idea of the ban, 100% pro, but how would that look like?
Lots to think about there. We have so many questions coming in online. We're not going to get to all of them, I know that. Nuan, one for yourself. From a policy perspective, should meal delivery apps be considered part of the regulated food environment in the same way that physical restaurants or supermarkets are?
Yeah, it's my personal opinion. Like, I think, yes, it should be part of. And like being on the both side, on the military platform, the police side, as well as internally. So I feel like it's not only the negative thing, like we can use military platform to promote the healthy options as well. So we should see it as a positive rather than like, yes, we don't need to invent new regulations. It should be fair, like what is available well for the physical environment should be applied to the military apps. But then we should think as like how we can positively use this thing.
And do you have suggestions as to how to integrate monitoring, such as of meal delivery apps, into existing obesity policy or surveillance of food environments?
Yeah, I think it's a regular, because like those meal delivery platforms, so like the online presence, it's regularly evolve. Like, so like you need some kind of like a regular monitoring way to understand how these things are over the time is changing. For like, if it is a island perspective, I would say like it's much easier because of the size of the digital food environment or meal delivery platform sizes. So it's something like with the technically, like you can monitor every month or every week. If it is the large country, it's maybe challenging. But like Ireland, like that's an opportunity. Like then, like over the time, you will understand the trends. So then that will helpful for the policymakers to make the correct decision.
Just to any of our speakers, have you seen any unintended consequences of restrictions? So maybe Rebecca, from your perspective, is there anything you expect to happen in the UK given the recent implementation of the restrictions, or Marta, from a Portuguese perspective, perhaps?
Yeah, so my main concern is that as, I guess, slightly more mainstream spaces become restricted, that these live streaming platforms are going to slip through the net. They're often like not clearly defined in documentation, and because they sit between social and gaming media, I think they do tend to fall through the cracks a little bit. So yeah, my concern is that there's just going to be this spillover into these platforms, and we're going to see, I guess, like an already vulnerable subgroup of young gamers and being exposed to more unhealthy advertising. Yeah, which I think why the scope and kind of definitions are very important as well.
Yeah, I think from the Portuguese experience and from what I have presented, we have already seen that we are restricting in some strategies and some channels, but the food industry and advertisers find other strategies to be able to advertise the products. For example, brand marketing, the sponsorship, but also, for example, in our evaluation of the environments around schools, we evaluated 14 schools in a 100-meter radius. That is what's in the law, but also in a 500 meters, which is mostly used in these kinds of studies as the distance that children are more likely to walk. And we found that in the 100 meters, there was only one advertisement that was non-complying. But then when we go further to the 500 meters, there was around 40% of the foods and beverages being advertised that don't meet the nutritional profile. So yeah, we have positive but also negative results coming out from this.
Here's an interesting question for all the panel, I think. Is there a role for government to pay to promote healthy foods to copy the success of these companies? I think probably do a little bit of this on in Safefood already in terms of the social media channels. But have you seen any good examples of governments or even NGOs taking on these techniques, if you like, to compete with unhealthy foods?
No. The closest thing I can think of is, many of you may be aware of Bite Back, the sort of youth-led movement sort of pushing back against food marketing. So I think they often sort of flip the tactics on their head a little bit. So they've done things like billboard takeovers where they've sort of tried to expose some of the more like insidious tactics going on with food brands. There's not lots of evidence that has been conducted to sort of assess the effectiveness of, I guess, what would be called like counter-marketing approaches. But that is something I have seen, and I know that is something that does energise a lot of youth and get them involved and sort of try and flip the narrative so that these brands are seen as less cool and maybe a little bit more creepy in the way they try to target them. So I think things like that can shift the narrative and shift the norm are important approaches as well.
And in Portugal, it's not related to unhealthy food marketing, but rather to breast milk substitutes and complementary feeding products. We also evaluated their exposure to marketing of women and pregnant women and mothers. And we have developed a best practices guide for influencers to know what they can and cannot do in these areas. So what's in the law, but also additional best practices. So yes, that's something we did. And we are also thinking of doing it for unhealthy food marketing and other types of marketing, alcohol, gaming, etc.
Please, yeah.
So I do think we promote healthier foods up to a certain extent, and there's many of you in the room doing that work. To even consider that we could have matching budgets to food industry is something I can't really conceive that us being able to go to the same extent. I also think it's important that even if that reality was somehow possible and we came up with the money, we would be putting again the burden of choosing healthier foods into the population, into the public, into parents. So there is a need to change the environment, being physical, being digital, and yes, we need to continue to promote healthier choices. But I don't think that matching industry funding to come up with the same strategies of advertising and having the public again fully responsible for the choices that they make, without shaping other things to being healthier. I don't think that's an avenue that we should be following.
And I think that's a lovely note in which to end our panel. Thank you, Joanna. Thank you, folks, for your participation. We are going to move again to the Mentimeter. So we're going to ask the same questions again. If you just get out your phones. Thank you to our panel. And go to mentimeter.com. Again, your code is 69537835. It may be there still on your screen from the last time. And the question we are asking now is, how confident are you in your knowledge? And we'll just give that a couple of seconds to settle and populate. I'm seeing a nice shift already.
Jason. Good.
Great.
So,
Just give that another second or two. But like you can see very clearly, we've moved from somewhat confident as a majority to fairly confident. So yeah, nice start to raising awareness in this issue. And thank you for your participation. So Claire O'Donovan from ASOI is going to close our conference for us today. Claire is, of course, partnering with us as well on this conference today. She is a registered dietitian, a member of the Irish Nutrition and Dietetic Institute and the Nutrition Society, and she's also the Public Health Nutrition Manager at the FCI. You're very welcome, Claire. Thank you.
Okay, so thank you so much for having the ASOI here today. I'm very much here representing the ASOI. So first of all, just want to say a huge thank you to Safefood for organising this excellent event. And as always, it's a real treat to go to a Safefood event. They're always very well organised. There's always excellent content and lovely refreshments as well. So I really appreciate all the efforts that go in to make it look so effortless. To Aileen, Joanna, to Daniel, and other Safefood colleagues here. So thank you so much. A huge thank you to Aveen from ASO Northern Ireland, and we'll have to chat later, Aveen, because we've never met in person. For I suppose for her opening comments, and also for the ongoing collaboration between ASOI Northern Ireland and ASOI. On this particular event. So I suppose just really to sum up, what a morning we've had here today, and it was definitely worth the journey from Dublin anyway, and for the rest of the colleagues coming maybe a bit closer to home. We had 4 excellent speakers on this really important topic of digital food marketing. So first up then we had Joanna, who spoke to us about Clickbite, and she told us about what is children's actual digital food marketing exposure on social media on the island of Ireland. And I suppose this is just such important data to have because it's the current state of play. So we know, where we're at in terms of what's the exposure, and also what children think about it, what parents think about it, and what advertisers think about it. And I suppose what struck me was the idea that it was very conservative, so it's probably a lot worse than and what those results, even though they were quite shocking. And also, I suppose to point out the words of the advertisers, mirroring, I suppose, the words of the parents. So things like murky, disturbing, sinister. I think they just really struck me that it's something that we need to be really aware of and to be doing something about. And then we had Rebecca, who spoke to us about marketing and gaming media. And for me, this was a very much a new area. I'm not a gamer, and I learned a huge amount. And again, I think for public health policy makers, that it's very important to understand this area to be able to effectively do something about it and to stop exposure of young people to HFSS foods. And also, I suppose what struck me was Rebecca mentioned, this nice idea of the suite of policies that has worked in Chile, and it's maybe something we need to think about here on the island of Ireland, and also the potential loopholes in terms of the UK legislation that's coming in relation to this, I suppose, complex area of gaming. Our third speaker then, Nuan, from WHO, gave a lovely presentation on meal delivery apps. And again, it's probably something that we don't think about in terms of food environment and how it's really reshaping food access, availability, pricing and promotions. And again, in real WHO spirit, he introduced us to a lovely monitoring platform. So very practical approach that we can systematically assess menu composition, pricing and promotional practices within the meal delivery apps, and how this approach can be applied to Ireland. And even he's done a bit of the hard work for us because he's done a little bit of preliminary research. So it's really nice to see that across the island of Ireland. And again, I suppose it's this important thing that we can use, the approach from the WHO, and then we can share experiences and learn from our colleagues across the European region, which is really important. And also, again, Nuan mentioned the new AI-based approach as well. And then last by no means least, we had Marta from Portugal, who told us about the important work that they did in bringing in this new legislation. And I suppose what really struck me was the length of time it took to bring in the legislation. And I suppose it's just something that we maybe forget about. I think it was a 13-year journey, so that's really important, that it's not a quick fix, that legislation takes a long time. There's a lot of steps involved, there's a lot of stakeholders involved. And I think even some of the questions highlighted the importance of who's actually in charge of the enforcement of this legislation, and what are the penalties and the fines that are required in terms of enforcement. And also, the impact assessment 5 years later. And again, just to congratulate Portugal, that's a huge amount of work, and you could see that all the different data that was collected. So again, it's really important that we can learn from our colleagues across Europe. So I suppose really just to sum up that each speaker provided us with insight into various areas of digital marketing. And I'd want just to thank all of the speakers for coming here today, for sharing your experiences, your evidence and your expertise. And now it's really up to us in Ireland, across the island of Ireland, to work together and to take this evidence and expertise and trying to do something about it to protect our most vulnerable population in this new area of digital marketing. And I suppose it's very timely to ourselves in the south of Ireland as we await the new obesity policy as well. So just to thank you for your attention, and I'll hand back over to Aileen.
Claire, thank you for such an elegant and comprehensive summary. Like, you did an incredible job of, closing out and helping us digest all of the information that we've heard today. Incredible, thank you. Evaluation is really important. Thank you for your compliments on our events. We like to keep those at a really high standard. We like to improve all the time, so evaluation is hugely important to us. For our online visitors, thank you for joining us today. When you end your session, you'll be brought to a QR code where you can fill out our evaluation. Please do. If you do it in the moment, you're much more likely to do it. And likewise, for our attendees here in the room, you'll see a QR code coming up on the screen, and you can use that to access our evaluation survey. It won't take you very long, but it's very useful for us. So safe travels to all of you who are here with us in person, and enjoy the rest of the day to those of you online. Thank you very much to our speakers, to all of you, and take care. All right.